Good morning students. In the previous session we have just seen an introduction to nursing process and we have seen the 5 steps of nursing process. So in this video we are going to see in detail about the first step of nursing process, that is the assessment. Assessing. It is a systematic and continuous collection, organization, validation and documentation of the data. In effect, assessing is a continuous process carried out during all phases of nursing process. Even though it is the first step, it is not limited as a first step, but when we diagnose, when we implement, we evaluate the patient, the assessment continues. Because we have to assess whether the condition is worsening, then we have to change our care plan, and if the condition is getting better. Collecting data. Data collection is the process of gathering information about the client health status. It must be both systemic, continuous to prevent the omission of significant data and reflects client's changing health status. A database is all the information about a client. It includes the nursing health history, physical assessment, primary care providers history, and physical examination, result of laboratory, diagnostic test, material contributed by other health personnel. Type of data. The two types of data, the first one is subjective data. It also referred as symptoms or covered data. So that the subjective data, otherwise known as covered data or as symptoms. They are apparent only to the person affected and can be described or verified by only that person. That means if you are suffering from a pain, only the person who suffers the pain can express the extent to which he has the pain. Nobody can see that. So itching, pain, feeling of worry are the examples of subjective data. It includes the client's sensations, feelings, attitudes, perceptions of personal health status and life situation. The second type of data is known as objective data. They are also otherwise known as signs or overt data. They are detectable by an observer, can be measured or tested against accepted standard. They can be seen, heard, felt, smelled, and they can be obtained by observation or a physical examination. For example, if the patient is complaining of temperature, we can always check it with the thermometer how much temperature this patient can. So constant data is the information that does not change over the time. Third type of data is a constant data. It does not change over time. Race, blood group. Variable data can change quickly, frequently or rarely, and includes the data blood pressure, level of pain. All this comes as a variable data. Sources of data. There are two types of sources. First one is primary and second one is secondary. The client is the primary source of data. All other comes as a secondary source. The family members, the support person, health professionals, records, reports, laboratory, diagnostic analysis, relevant literature are the secondary source of data. Data collection method, how we get the data. The main methods used to collect the data are observing, interviewing and examining. So three ways to collect the data from the patient. First one, we can observe the patient, we can interview the patient and we can examine the patient by doing a physical examination. Observation occurs whenever the nurse is in contact with the client or support person. Interviewing is the major method used in physical health assessment. First one is observing. To observe is to gather data using our senses. Observation is a conscious, deliberate skill that is developed through the effort and with an organized approach. Although nurses observe mainly through the sight, most senses are engaged during the careful observation. Observation has two aspects: noticing the data and selecting, organizing and interpreting the data. The nurse who observes the client face is flushed must relate with that observation to the findings such as body temperature, activity, environmental temperature and blood pressure. Errors can occur in selecting, organizing and interpreting the data. An experienced nurse is often able to attend intervention, that means give a bed bath or a modern IV infusion. At the same time, she can make important observation. That means observation is not a separate thing we can do. It can be done along with our other nursing procedures, like when we do a IV cannulations, we can experience if the patient is having any change in the respiratory status or skin color. But a beginning student must learn to make observations, complete tasks simultaneously. Second method of getting data is interviewing. The interview is the planned communication with a purpose, for example, to get information, identify the problems of mutual concern, evaluate a change. There are two types of interview, that is directive and non-directive. Directive interview is highly structured and elicits specific information. The nurse establishes the purpose of interview and controls the interview. During a non-directive interview or a rapport-building interview, the nurse allows the client to control the purpose, subject matter and pacing. Rapport is an understanding between two or more people. The meaning of rapport is the understanding between two or more people. A combination of directive and non-directive interview usually appropriate to get information from the patient. Examine, that is a third way of getting information or assessment, that is examining. Physical examination or physical assessment is a systematic data collection method that uses observation, senses of sight, hearing, smell and touch to detect health problems. To conduct the examination, the nurse used technique of inspection, auscultation, palpation and percussion. We will see in detail about the physical assessment in the coming videos. So, physical examination is carried out systematically. It may be organized according to the examiner's preference in head-to-toe approach, that is cephalocaudal, that is from the head to the foot, or a body systems approach. Body system means respiratory system, cardiovascular system, hematological system, endocrine system, like that. Next step is, once we get the data, our next responsibility is to organize the data. The nurses uses the written format and organize the assessment data systematically. This often refers to a nursing health history, nursing assessment or nursing database form. Third one is validating the data. Once we organize the data, we have to validate it. Information gathered during the assessment phase must be complete, factual and accurate because the nursing diagnosis and interventions are based on this information. Validation is the act of double checking or verifying data, confirm that it is accurate and factual. And third, the final step of assessment is documenting whatever information we got through the assessment, how to document the nurse's record. So thank you for listening.